Hi, I'm Dr. Joseph Witt-Doering, and today it's my pleasure to welcome Carlton here. He's going to tell us about his PSSD story. Um, I don't I haven't seen a lot of people talk about their experience with PSSD, so I think it's incredibly important to have someone like Carlton on, kind of walk us through what happened to him, and then the impact it has on his life. So, with that said, Carlton, welcome. Thank you so much for being here. And I'm going to turn it over to you to give us a brief overview of what happened to you.
Yeah, thank you very much, Dr. Whitthorne. It's great to be here today with you. Thanks for having me on. Yeah, so let's go through how this all began. So my PSSD story, it began when I was I was put on the medication when I was 15. Not the same reason as most people. Obviously, antidepressant medications are usually prescribed for depression, anxiety, but I was going through bad IBSD when I was in high school. And yeah,
IBSD, could you spell that one out for the audience?
yeah, it's irritable bowel syndrome.
Yeah. Hmm.
Yeah. Yeah.
Yeah.
So yeah, I was struggling with that. So I went to the GP and I was referred to a gastroenterologist.
Hmm.
And this is where I acquired the medication, which was nortriptyline. And he said, yeah, this is often used in IBS treatment. This should work and this should help with your symptoms. So obviously, being 15 at the time, I just believed in the power of medicine, like this is going to work, this is going to be fine. And I took the medication and I stayed on it for quite a few years. So I was on it for about 7, 8 years, I'd probably say. And yeah, I was never really, yeah, it was just every day. Like it was just a regular day thing. So I take it every day before I go to bed once. And then, yeah, I was never really monitored like by the GP. I just stay on it chronically. Well, now looking back, that's probably like not a great indicator of how this has occurred. Yeah.
Hmm.
So I'd say when I started to notice was so I got a call from my GP last year. I was 24 at the time, and I'm turning 25 next month. But yeah, so he gave me a call and he said, look, Carlton, you've been on this drug for a while, you've been on it for years, and it's probably not aiding you anymore. So what we want to do is we want to get you off of it. And I said, yeah, that's fine. It's probably time to just get off this drug and just live without it. So, but at the same time, he said that the drug would be getting discontinued by the NHS, which is so oh, okay, well, what I'm going to do, Carlton, is I'm going to switch you to a different drug, and then we'll wean you off that way. So without tapering me at all off the drug, he switched me to amitriptyline, which is another tricyclic antidepressant, which is also used in irritable bowel syndrome treatment.
Hmm.
And yeah, so that he prescribed me a 1 month course of that medication. And I basically, without any tapering guidance, kind of weaned myself off over the case of 1 month. And it wasn't soon afterwards that I started to notice PSSD symptoms.
That's interesting. Yeah. Um, so tell us, what were the PSSD symptoms that you noticed?
Yeah, sure. So, I mean, the first was probably what most people encounter. It was the genital numbing. So, for the last year, I've had absolutely no erogenous sensation in my penile glands at all. It's been like this for a year now. So that was probably the first symptom that I noticed overall. And because I was just thinking, like, why does it feel like rubber? You know what I mean? Like it just feels like rubber now. I've got no pleasure at all. And then I obviously noticed it when I was masturbating. And
Mm.
I was just thinking, why does this not feel pleasurable anymore? Like what's happened? You know what I mean? And that was a big shock. And at the same time, that's when I noticed as well that I was dealing with severe erectile dysfunction. So I could obtain an erection, and then within about 30 seconds it would just like it would go completely. So yeah, those are two symptoms. And then obviously I also noticed premature ejaculation for the first time in my life. I'd never had premature ejaculation before tapering off the medication. That was all new to me, and that was a shock. And yeah, those were the first symptoms I started to notice. And then
Which I was going to ask just quickly, when you say it felt like rubber, is it? I mean, would you say, that like the penile glands? It just kind of feel like when you say no erogenous sensation, is it like you're touching your forearm or like the back of your elbow where there's not a lot of sensation, or is it even different from that? Because there's a difference between, I guess, your normal somatic sensation and then, like you said, that erogenous sensation, which is down in the genital area and leads to sexual pleasure and such. So I was just wondering if you could, was it like any other kind of touch on the body?
That's a good question. I would say probably, yeah, it does just kind of feel like the back of your hand, like, or well, it's just you've got nothing. Like you touch it, you're touching the most sensitive part of your body, your penile glands, and it's just like you just can't feel anything. Like it's just there. It's just there's like it's like a sponge. You know what I mean? Like it's like a spongy effect. You know what I mean?
Sure.
Like
Okay.
Yeah, you just can't feel anything at all. It's really weird. It's a really strange sensation to like have to go through, I'd say. I'd say the back of my hand.
Great.
Thanks
for clarifying that. Sorry, I interrupted you for that.
No,
so please go on with your train of thought if it's still there. Yeah.
No, that's fine. It's like, I'd probably say that's about it. Yeah, it's just you just don't feel anything. Like that's the thing. It's just nothing at all. Like no erogenous sensation at all. No, like no pleasure. Like just no pleasure at all.
Okay. And I guess roughly how long after you tapered yourself off amitriptyline did you notice this? Was this something that happened, 2 weeks after the last pill, or was it something that happened when you went down? Like, what was the timing like for you when you first noticed it?
I would probably say like maybe a few weeks. So maybe like 2 or 3 weeks it took to probably like notice everything. Maybe I was a bit oblivious at first, I think. Like, maybe I just didn't realize it first at all. And I just thought everything was normal. But then like, I'd probably say over the course of 2 to 3 weeks is when I really started to notice the symptoms like begin from,
And while you were on the nortriptyline and the amitriptyline, looking back on that time, I'm assuming masturbation was kind of normal. All of that kind of stuff. It wasn't challenging to maintain an erection in the same way that it was now. Could you speak to that? Did you feel like when you were on the medications that it was, mostly normal? Maybe there was a little bit of that normal kind of sexual dysfunction that is very typical with the antidepressants, but nothing severe yet. Could you speak to that a little bit?
Yeah, I think probably it was mainly just normal. I'd say like I would probably describe it as just normal, like overall. Maybe there was, like you say, like mild, like, but I don't think it was severe enough for me to really like notice, like to take like a real attention to it. Like there might have been a slight sexual dysfunction, but it wasn't anything out of the ordinary for me to say, like for me to really realize that. So, yeah.
And so you come off the medication, you start noticing that you have abnormal sensation in the genital region, and then also difficulty maintaining an erection and reaching, I guess, orgasm. What other symptoms did you notice?
Well, it was just like, I think it's, so when I'm like outside and like I'm interacting with attractive women, like I did notice that there wasn't like as much as a response cycle. So like I could speak to a girl I really liked, but there would just be no like response whatsoever. Like just overall, like I just got no like feelings of like passion and like attraction. And yeah, that was probably the most worrying like aspect of it, because I was thinking like what has happened here, you know what I mean? Like it's not so much that you just suddenly go from like really like being like really attracted to people you like, and then suddenly it's just like, oh, these people are nice, but I'm just kind of here, you know what I mean? Like I'm not getting anything from it.
It's like
Which
that
is
sense has been kind of cut off. And I want to ask as well, aside from that happening in person when you're interacting with someone that you find attractive, did you notice the same thing with, say, pornographic material? Was it, were you looking at it and just again having that distance where it's like, this is not arousing in the, in the same way it used to be? I was curious
Well,
about that, like the different
yeah,
settings. Yeah.
it's really interesting that, because I feel like at first it was like that, but I feel maybe within the last few months it has gotten a bit better. So to the point of where sometimes I can look at like pornographic material and like
Hmm.
at first I noticed that I couldn't achieve an erection without like self-stimulating myself.
Hmm.
Like that was how it went at first. But as the time's gone on over the past year, I have realized that now, like I have gotten a little bit of that back. So like I have noticed that recently I have been able to like have an erection just looking at material. So
Hmm.
that probably has improved. But apart from that, it's not all the time. So like sometimes it'll like occur, but sometimes it won't. So it's very off and on. And like I've also noticed that I can like sometimes on things that like foods I eat or something, or drinks, like if I consume caffeine or alcohol for example, that response kind of like diminishes. So it's really like interesting. I don't know why.
Diminishes the like diminishes your ability to have a normal erection, or it makes it harder.
Yeah,
Yeah.
like just like the whole arousal thing. Like
Yeah.
sometimes like notice that it's like it's not like it's harder to get aroused after those kind of things, which I found really perplexing.
Okay,
Um
so more sensitive to those
yeah,
things in that way. Um,
yeah.
okay, so another thing is, often people in the PSSD community, sometimes they describe feelings. I guess effects outside of just sexual effects. There may be emotional or cognitive and different types of things. Did you experience any changes, I guess, outside of the ones that you've already described?
It's like cognitive function. I'd say mainly it's just I have heard of the cognitive symptoms. But
Hmm.
I would say I probably just like developed like apathy towards the whole situation. I wouldn't say that it was exactly like I had any like bad cognitive dysfunction. Like some people
Hmm.
have reported, for example, like not being able to concentrate on certain things and things like that. So I wouldn't say that I've really struggled with that, but I think it's mainly just apathy. So like I developed like just apathy towards the whole situation that I was in, like regarding like the sexual dysfunction, if that makes
Hmm.
sense.
Okay.
So like yeah, so like that's probably just more emotional based. Like I was getting like quite angry and like upset as
Hmm.
yeah, I'd say. Yeah.
And as time has gone on, I know you mentioned that achieving an erection without manual stimulation has sort of come back. Do
Yeah.
you notice any change in the level of numbing down there, or has that stayed persistent for the last year?
That's just stayed constant this last year. I'd say like there's just been no change whatsoever in the genital numbing effect, which yeah, that's no, yeah, no changes there, unfortunately.
Okay. Um, going back to the cognitive stuff, I mean, um, do you still, you mentioned apathy towards the situation, but are you having any problems with, I guess, apathy towards life in general, feeling like, lacking motivation, or lacking, feeling like it's difficult to connect with other people or care about them, or, those, I'm trying to imagine what I imagine kind of an apathetic state, how that might go out into other things that you do in your life. I wonder if you could talk a little bit about that.
Yeah, that's a great point, because I think one of the struggles with PSSD is that you can't escape it. So, for example, so if I'm going to like my classes, for example, my university classes, like it's just like the problem is you can't escape the condition. It follows you everywhere. So, for example, like for the first 6 months of my like university term, like that began in September, I had to like walk past like my student union, and it had like a big banner on it saying, "Let's talk about sex." And like that was brutal from the get-go. So it's like, I think the thing is with PSSD is that you develop apathy because the condition follows you around everywhere you go. So it's like, say, for example, I'm like, okay, well, I'll listen to like, oh, a new song's come out by a singer I like. And then the song's about like love and romance and things like that. I'm like, oh, well, that sucks. Well, what am I going to do now? Oh, I'll watch TV. You know what I mean? And then I'll go and watch TV. And then the show will proceed to have romance scenes and sex scenes. And I'm like, okay, well, not doing that. What else should I do now? And then I'll say, okay, well, I'll go out and hang out with my friends. And then my friends, the conversations I'll have with them is like, they'll strictly be like, oh, how's your dating life going? And oh yeah, I'm seeing this person. That's great. And it's like, you just can't escape it wherever you go. I think that's probably the apathy that you develop, because it follows you around anywhere. It's like you can't escape. You can't escape PSSD. You know, it just follows you around wherever you go.
That was really nicely said, and really insightful. I want to stay on that point if that's okay. Tell us about how this has affected your life over the last year.
Well, it's a good question. Well, I'd say like for the majority of sufferers, I'd say, well, it's pretty much ruined our lives, really. Like we don't, like I'm 25 years old, and I'm thinking like, how am I going to keep a relationship? You know, like I really, really want one. I'd love a girlfriend. I'd love a supportive partner, and I'd like to get married. That's my goal, and I'd love to have kids. But with PSSD, it's like we have to like, I have to face up to the reality that this is going to be difficult. And that's really difficult to accept every day, I think. And I think that's probably where it affects you the most, because I think the thing is with PSSD, we're all normal people. You know, we have normal lives. We want normal lives. We want love, we want romance, and we want kids and, you know, wives and husbands. You know, that's probably the way I would say it. I'd say we want our bodies to go back to the way they were. And, you know, and having to wake up every day in this body and face the world, it can be really challenging, because we just want to go back to the way we were. And yeah, I'd say that's probably the most apathetic part of the condition, is that we long to have something. You know, we long to have what we had before the meds, basically. That's the way I.
And you know, and I have been on your YouTube channel. I know, you know, I've told you this before, and you talk about like I guess the challenges. Well, I guess, yeah, the challenges, you know, dating and all of those things, and I imagine that, you know, if I were in a position where something like this happened to me, you know, you'd worry about feeling inadequate in a relationship, even though it's nothing that you've done before, but you'd feel like, I think you say it quite well, you know. You would want to be able to do those things with your partner, and it's quite hard to kind of accept that you may not be able to fulfill them in that way, and how that can weigh on you and your self-esteem.
I'd say so, yeah, because at the end of the day, if you're in love with someone, you just really want to like be there for them, and you want to give them the best possible experience in a relationship. I'd probably say that's the way I would see it. Like, you know, if I was desperately in love with someone, I would just want to give them everything, you know, like I'd want to give them all of me, just because that's just how in love you are with somebody. You know, you just want the best for them at the end of the day. And I think that's a great point you make, because I think that's a good point about like how we would probably feel, because we would feel that like inadequate, probably, like we'd feel scared probably, like about like we wouldn't want any relationship to end because of this, you know what I mean? Like we just want to have a normal life, you know, we just want to have a normal relationship. We don't want to have to struggle with this condition, you know, because none of us asked for this at the end of the day. Like we just want to be, we just want to have a normal relationship. Like I didn't, like when I took the meds at 15 years old, like I didn't know that I was signing off my rights to have like romance for like the rest of my life. Like if I'd known that, I would have just been like, please, no, I don't want this, you know, like none of us would want this at the end of the day. And that's, I think that's probably the main point, I'd say.
Yeah, yeah. I mean, it's there's a lot of interesting threads to kind of discuss there. I guess the thing that is interesting at the moment is that PSSD has recently, well, I guess the first point is it's there are some people where it seems to go on for decades. You know, I've seen that and I have read about that, but there are a lot of people who recover and fairly quickly. And you know, you might reach 18 months and have a different story to tell at that time, and we don't know. So you need to maintain hope that you can recover, because that does occur. And I've read a lot of stories about that. The other thing that
I think that's the main task. I think we have to stay positive. You know, it's all we've got at this point, you know, like I think that's a big issue, like in the community. Like we kind of like whenever we find out something, we latch onto it, because all we want is hope. At the end of the day, we want hope. So when we see like, oh, there's a new, say like Risk put up a new post, so like CCM testing to try and find out if it's small fiber neuropathy, you know, if we're dealing with this. When we read this, we latch onto hope and we think, okay, well this is what PSSD might be. And then when we read things about kispeptin, you know, kispeptin's in trial for libido and hyposexual desire disorder, can this be used in PSSD? And you know, pirenzepine for the small fiber neuropathy as well. Can this help with genital numbing? It's like we kind of like we're desperate for anything at this point. Like, you know, when we get any news of anything, it just, I think we probably just react like we just want, like, I don't know, we just want help. You know, we just want to be acknowledged. Cool. and get and just get some treatment for this, I'd say.
You know, and speaking about the, you know, acknowledgement, something that's really interesting is that the EU put it in all of the antidepressant labels, which is great. And the Health Canada put in a watered down warning as well. I mean, it's still in there, but with very, very weak causal language, but at least it's in there as an important risk. The FDA, though, in the US, in the biggest market in the world, it is still not there. And I think that discrepancy is really interesting, because from my perspective, I mean, there are a couple things out there which really made me rethink antidepressants, because, you know, you may not be aware of this, Carlton, but the US is, I think, one of the only countries out there. Well, actually, I won't say that because I haven't looked at that many, but I know compared to the EU and I think Canada or Britain, the US recommends antidepressants as a first-line treatment for depression. If you go to the EU or you go to the UK, they recommend psychotherapy. And the fact, and when you have a drug that could potentially cause sexual dysfunction lasting years, and it's completely random, you know, there's no way to predict who this is going to happen to, you know, and we, you know, I'm pulling numbers out of thin air, but let's just say that it happens to, I'm going to choose a very conservative number. Let's say it happens to 1 in 500 people or something like that. When 10% of your population is taking these medications, and that's what's happening in the US these days, that is massive. You know, that is a huge amount of people who may be getting injured by this. And The fact that
Yeah.
this is not in the label, I think is horrendous, because I think if doctors saw this in the label, and if the doctors knew this about it, they would not be recommending antidepressants as first line treatment, and a lot of problems would be avoided.
I think so, yeah. But I think like a problem is as well, like you say that the EU have now put it in the packaging, and like you say, it's very, very like discreet. So like it might say, okay, you can get some lowered libido, you can get some erectile dysfunction, but that's nothing to what PSSD is. Like they really should put, like, I don't know how they haven't put about your genitals going numb in the packaging. Like, the first record of that I found was 2007. It's been in the medical literature since 2007 about genitals going numb. So how can we be 15 years later and that's still not on the packaging, like when it's happening to an alarming number of people? I just don't understand personally, like, why that's not on the packaging personally.
It's interesting, and I think about this as well. I mean, there's so much talk about we don't want to stigmatize mental illness. We don't want to, and by that I mean, that's translated into, we don't want to overemphasize the risk of the drugs because we're going to scare away people who really need treatment. And while that makes sense in some way, in other ways it absolutely makes no sense at all, because I mean, really what you owe a person is a full understanding of the risks. And let's say someone comes in with mild depression and you tell them these things and they go, well, I don't think they feel stigmatized about it. They would feel like, or they wouldn't feel you're stigmatizing their mental illness. They'd say, thank you for helping me make an informed decision. You know what? I think I'm going to persist a little longer. But then you might have someone that comes in who is so severely depressed they're bedbound, and they'll say, well, thank you for letting me know that risk. I'd like to proceed anyway. So really what it does, information facilitates better conversations between, healthcare providers and the patients to make the choices that are right for them. Because even with this risk, there may be a population of people that will choose to accept it based on their individual circumstances. It's always a possibility, but, to water down the risk, to put it in weak language, to kind of hide it, I don't think that really serves doctors or serves patients at all. I mean, I think it serves drug companies. I think it helps avoid a lot of uncomfortable conversations about why they don't have any proper risk mitigation measures in place, or why they haven't run any research to figure out what, who is actually at risk of this side effect, because all of that's costs money, and then they would have to fork out the money or come up with some kind of plan. So that's I mean that, and then the next question is, why, and this is interesting. You have a risk that would be so important to someone, especially if your demographic, you're a young man, you're in your 20s, and this even happened when you're in your teens. I mean, how was this risk, not sent out to every single family medicine doctor and every single psychiatrist in the EU when it was recognized in the labeling? I mean, to me, it rises to the level of importance where that level of risk mitigation would have been warranted, because, they put it in the label and people might not read the updated label. And drug regulators, pharmaceutical companies, they have the power to say, we're going to send this out to every single family medicine doctor, every single OBGYN, every single psychiatrist with information about this, so they know it's in there immediately. We're going to present a symposia on this at the next, American Psychiatric Association, like EMA equivalent. But they haven't done these things, and to me that's just shocking. It almost feels like they're putting it in there to cover their ass, but not really wanting to get the message out there about something that is so serious.
Yeah, true. And it's like the drugs are used for not just that, they're being used for lots of other conditions as well. I know of people who have been on it for like premenstrual syndrome, and they've had now PSSD for 8 years, and they say it's ruined their relationship with their partner completely. So I just think with the amount of things that antidepressants are being used for these days, you would think that they would be more aware of what can happen. And especially like when, the prevalence that it's getting on social media now as well. Like like the PSSD network as well. They're getting a lot of traction on TikTok, for example, and people are just now finding this account and they're now realizing that they have the condition. Like you go on to TikTok and you watch the videos and people comment on there, young people comment on there saying things like, oh, so that's why I'm asexual now, or, you know, I've been on SSRIs for a decade and now I think I'm asexual, and then, you know, stuff like that. And they're asking questions here of which they weren't told, which could happen. And I agree. Like I just don't know how this has happened at all. Like they just, like, people are just now realizing, you know, they're going onto these social medias and like they're clicking, oh, I think this might have happened to me.
Yeah, and I mean, you've kind of
Like,
you
why
know,
should they be found out by social media?
that's
As
crazy. I mean, the PSSD network is like a risk mitigation arm of a pharmaceutical company. They're doing the job of the drug companies, getting the information out there. It's all volunteers. It's all people spending their time to when there's fully resourced companies out there that could probably do this with incredible reach. But it's not just in PSSD. I see this with the benzo problems, with the
yeah,
severe withdrawal issues, and also with the severe withdrawal issues for the antidepressants. It's crazy how little risk mitigation is going on for something that's so prevalent.
yeah,
The other thing that I think is really interesting there, and it kind of ties into a cultural thing going on at the moment, and not to diminish that there is a lot more talk about gender identity, sexual orientation, and things like that these days than there used to be. And it's true, the world may be a more accepting place for these things to come out, but I
yeah,
don't think you can overlook the fact that with 10% of the American population, and probably something similar in the EMA in the UK, that a drug that could effectively blunt someone's those sexual feelings that they're having could have huge consequences for the way someone sees their identity and their sexual identity and all of these things. And it
true,
would be
yeah,
so confusing for people.
yeah, yeah, yeah,
Yeah.
yeah. I think for me, it's like, you know, because I had like was on the drug for years, and
Hmm.
I was on the drug for years, but you know, I was still very like sexually, like I was in touch with my sexuality still on the drugs. So for that reason, you know that you know your orientation when you've been on there for, you know, for years, and you've experienced like feelings of sexual attraction for, you know, the opposite sex or the same sex, for example. Like, but you know, some of these children now that are being put on SSRIs, and other drugs like that, like finasteride and isotretinoin, for example. You know, some of these people that are being put on these drugs, especially like children, they could grow up without knowing that, you know, what that feels like. You know, I'm quite lucky in the sense that, you know, I grew up whilst on them and I still had it. You know, I could still identify as, oh yes, I'm straight. You know what I mean?
Hmm.
But people now are now growing up and they might not know. So this is hugely concerning, I think. Definitely.
Yeah. It's definitely one factor that could definitely weigh on on your level to understand those things about yourself, which is so important, especially when you're young and your identity is really, being questioned. So,
Yeah, I think
gosh,
so.
yeah. Um, one thing I wanted to say, which we haven't touched on,
Mm.
the most compelling thing about Carlton's story is, it's not that there was difficulty maintaining an erection or reaching orgasm. It's the fact that he had genital numbness. Now, there is no condition that I know of apart, that commonly causes someone's genital region to feel like the back of their hand. You cannot have that with blood pressure problems. And that's the most unique thing. It's probably the most unique symptom about PSSD, which really makes it stick out. You have people there who are so numb in their genitals that they literally feel nothing. I know David Healy talks about a clinical. He has a story from someone who reached out to him about, they've put like a spicy powder on their genitals to even see if that would register, and there was nothing. And so that's the thing that really sticks out, that really makes this what I think a totally valid and worthwhile adverse reaction. I mean, it's very difficult to explain that away. I can't think of an alternative explanation for something like that happening, and it's just occurring with such frequency in people who are having problems just as yours.
Yeah, and I think, to be honest with you, I think the main worry for me is that, you know, we've had reports of this syndrome since the 1990s. You know, it was first reported in the 1990s. But with the drugs that I was on, the tricyclic antidepressants, you know, that's just proved that we can get PSSD from those. And those were FDA approved in the 1960s. So we have to be honest and say, like, before the times of the internet, I'm personally worried for like the people that might have gotten PSSD before the internet, because what would have happened then? You know, they might have gone along, because they would only have their doctors. Like there would be no forums back then for this problem if people were having sexual difficulties on the tricyclics when they first came out in the 60s. So I sometimes think to myself, like, I'm very worried to think about how many people might have been lost to PSSD before the internet was a thing.
Yeah, I mean, it's shocking. I'm trying to think about, you know, what would have happened to you back in the day if that happened. My best guess is that, you know, maybe you would end up seeing some kind of sexual therapist or sexual counselor pursuing a type of treatment that really wasn't suited, you know, for the condition you had, you know, talking about, you know, maybe psychological things that really aren't playing that big of a deal. You're investing a lot of money into it. You feel like, and you're just looking for some, you know, it's been misdiagnosed, and you're just losing your resources following these treatments that, you know, that don't really help. When someone maybe just should say, you know, hang on day by day, you know, it's likely it's going to get better over the long run, and just hang in there. And it's real. There's nothing wrong with you. And it's just something that's happened to you. You know, they would have been sold a totally different story, which probably, you know, it would have just wreaked havoc on their life and their understanding of who they were and their sexuality and all of that. I think that's good that you're thinking about that, because I am too, and it's pretty grim.
You know, marriages as well. Like, how many marriages have been affected by this? How many marriages have ended because of this? And like you say, they would have been referred to like a counselor or something, which, you know, that wouldn't have helped at all if it's a drug-induced injury. So I'm also worried about how many marriages might have been affected by this as well. You know, and we're talking about marriages that might have been 10, 15 years, you know, like they might have had like active sex lives all that time. And then, of course, suddenly you might start on a antidepressant or another drug, and then, you know, you lose your libido and your function, and then the marriage might suffer as a result of that. So that's another huge thing we have to think about, and think how many marriages have been affected by this.
Well, you know, Carlton, I'm about out of questions. I mean, nothing's coming to my mind at the moment. But was there anything else that you wanted to talk about that you think is really important to get out?
Well, I think, you know, the one thing I just want to say is and this is just like to go forward with this whole PSSD thing, because I think we are making strides now, just in the media. You know, we've had like a lot of articles in the last year, and, you know, there is hope out there, because, you know, with these treatments that are now being, you know, they're now coming out there about neuropathy, perhaps CCM testing, you know, we do have hope. So I think the one thing I would just say is we need to, you know, since the first record of this being in the 1990s, you know, I think this has gone on long enough now. I think it's time to open up, and I think it's time to really get the message out there that we're not accepting this anymore. And, you know, we need help we can't do this alone, because of the thing is that the funding for the treatments are all the patients donate to it. So Mel Cagney's study in the University of Milan, for example, that's all patient funded. So we can't do this on our own. We need help here from the medical industry. And this is exactly why I'm here with you today, to just try and get this out there, really. You know, we need support. And I think we've just got to talk about this, because if we don't talk about this, then we risk another 30 years down the line where we're still I don't know, like we're still battling and saying like, oh, have you tried this? Have you tried that? Rather than getting a real treatment. We need a real treatment. So it's time to open up about this and talk. That's
Excellent.
yeah.
Great. And one more thing I want to ask, and it's really mainly just for the record, but it's apart from the IBS, did you have any other medical conditions when all of this was going on?
No, not really. No, I'd
Okay.
say that.
And were you taking any other medications?
Well, this is the thing, like for the IBS, they had me on like quite a few medications, like jerked up completely. Like I was on mebeverine, for example, and I was on opiates like codeine phosphate for a lot of years as well. So I was really pumped full of drugs back then as well, which lasted for many years.
But when the PSSD started, a few weeks afterwards and went on, were you still taking other medications throughout that period?
Yeah, some, yeah.
Okay.
Yeah.
And what were they?
They were mebeverine.
Mebeverine. Okay. Perfect. Okay. Send people my way, Carlton. If other people want to talk about this, I'm going to do everything I can to, promote these videos and put out more content like this so people can come and they can hear what it's like, and really see what the condition is. So I'd love to hear from you and the PSSD network.
I think the one thing is just like, with PSSD, it feels like my life is on the up because in one way because like I'm achieving in life. I'm finally like I'm gonna study abroad in Japan next year, which is cool. I'm looking forward to that. So like the thing is with PSSD, it's like there's parts of my life which is like it's good, but then this just completely like overshadows it completely. So it's like you've got one half of like you might be achieving in life, but then you've got the other part of it's like where this just weighs you down completely. So like,
Totally.
Yeah.
Okay. Well, Carlton, thanks again. It's been a pleasure talking to you, and thank you for doing this.
Thanks for having me. It's been a pleasure.
Okay. All right. Take care.
Thank you.